Welcome, Eleanor. Today, we're diving into weaving care, hospice in the community ecosystem. Our focus will be on understanding how hospice physicians build vital partnerships and educate communities to ensure comprehensive, aligned patient care. This is crucial for truly holistic end-of-life support.
Thank you, Maggie. I'm really looking forward to this. I've been keen to grasp the practicalities of community engagement and education in hospice, as it seems like such a critical yet often complex aspect of care.
Exactly. We'll explore the nuances of building those community partnerships, the strategies for effective community education, and also touch upon some of the inherent challenges in hospice care that these efforts aim to address. It's about understanding the evolving role of the hospice physician within this broader ecosystem. Following our initial discussion, let's now focus specifically on building community partnerships. This is a cornerstone of effective hospice care, ensuring comprehensive and aligned patient support.
Maggie, could you explain the fundamental reason why these community partnerships are so vital for hospice physicians?
Certainly, Eleanor. The primary objective is to align patient care goals across the healthcare continuum. This ensures that all mutual patients receive appropriate care regardless of their specific setting.
So, it's about consistency in care. Which specific organizations are hospice medical directors and physicians encouraged to partner with?
Key collaborations involve medical leaders at hospitals, skilled nursing facilities, Veterans Affairs medical centers, and accountable care organizations. These are the primary entities within the community ecosystem.
That's a broad range of partners. What is the nature of these diverse organizations?
It involves active collaboration and communication. Hospice physicians serve as resources for community questions and work to integrate hospice services seamlessly into the broader healthcare framework.
And what specific outcomes are expected from these collaborations, beyond just aligning patient care goals?
The goal is to ensure that the objectives of patients, their families, the hospice organization, and the partner institutions are all consistently aligned. This creates a unified approach to end-of-life care.
So, it's about a shared understanding and mutual support for the patient's journey. How do these partnerships contribute to the overall community knowledge about hospice?
By engaging with these medical leaders and institutions, hospice physicians inherently educate the broader medical community. This increases awareness and understanding of hospice and palliative care options.
That makes sense. It sounds like a form of indirect community education through professional collaboration. Could you summarize the core benefit of these partnerships for the patient?
For the patient, the core benefit is receiving comprehensive, coordinated care that respects their wishes and goals, regardless of where they are in the healthcare system. It minimizes fragmentation of services.
And for the hospice organization itself, what is the primary advantage of investing in these partnerships?
For the hospice, it ensures that their services are recognized and integrated within the community's healthcare offerings. It also facilitates appropriate referrals and strengthens their role as a vital care provider.
So it's mutually beneficial for all parties involved. Are there any specific strategies for initiating these partnerships effectively?
Initiation often involves direct outreach to medical leaders, offering educational sessions, and participating in interorganizational meetings. Building trust and demonstrating value are key.
It seems like a proactive approach is necessary. How do these partnerships relate to the interdisciplinary team model we discussed previously?
These external partnerships extend the interdisciplinary team concept beyond the hospice's immediate staff. They create a broader, community-wide interdisciplinary network supporting the patient.
That clarifies the interconnectedness. So, building these partnerships is fundamental to the holistic and person-centered care model.
Precisely, Eleanor. These collaborations are not merely administrative. They are essential for delivering the robust, person-centered care that defines modern hospice services. Eleanor, following our discussion on building community partnerships, let's now focus specifically on direct community education. Over the past 4 decades, there has been a significant increase in awareness regarding hospice and palliative care among both the medical community and the general population in the U.S.
So, the understanding of hospice has grown considerably beyond just healthcare professionals?
Precisely. This heightened awareness has led to a diversification of referral sources. Referrals for hospice services are now expanding beyond traditional medical channels to include direct requests from patients, their family members, and caregivers.
That's a notable shift. Does this indicate a more proactive engagement from the community in seeking hospice options?
Yes, it does. This evolution underscores the pivotal role that community education and outreach have played in establishing the value of hospice care.
So, education isn't just about informing, but also about demonstrating the inherent worth of hospice services?
Exactly. It's about integrating hospice into broader healthcare practices, ensuring it is seen as an essential component of comprehensive care, not merely an alternative.
And how do hospice medical directors and physicians contribute to this direct community education?
Hospice medical directors and physicians are crucial in this effort. They actively involve themselves in community education initiatives and serve as primary resources for other healthcare providers and the public.
Are there specific methods they use for this outreach?
They might conduct public seminars, participate in health fairs, or provide educational sessions to local community groups and professional organizations. Their expertise is vital in clarifying misconceptions and providing accurate information.
So they are not just managing patient care, but also acting as educators and advocates within the community?
That's correct. Their involvement ensures that accurate information about hospice, eligibility, services, and benefits reaches a wider audience, fostering informed decision-making.
And this directly supports the expansion of referrals you mentioned earlier?
Yes, it creates a feedback loop. Increased understanding leads to more appropriate and timely referrals, which in turn reinforces the value of hospice within the community.
To summarize, community education has evolved from basic awareness to active integration, driven by diversified referrals and the direct involvement of hospice physicians as educators and resources.
An excellent summary, Eleanor. This systematic approach to education is fundamental to the continued growth and acceptance of hospice care.
Are there any specific challenges in educating the community about the complexities of hospice care?
One challenge is addressing the common misconceptions about hospice being solely for the very last days of life. Education helps clarify that hospice supports quality of life for months, not just days.
So it's about shifting perceptions and ensuring a broader understanding of the scope of care.
Precisely. Effective community education helps align expectations with the comprehensive support hospice truly offers. Eleanor, having discussed community education, let's now delve into the inherent challenges within hospice care itself. Understanding these is crucial for effective practice.
I'm ready, Maggie. What's the first significant challenge hospice physicians encounter?
A primary challenge involves eligibility and prognostication. Hospice medical directors and hospice physicians require strong skills in predicting patient trajectories and a deep understanding of complex eligibility guidelines.
So it's about accurately determining when a patient qualifies for hospice and for how long.
Precisely. They must advocate for patient access while simultaneously ensuring the appropriate use of the Medicare hospice benefit, which has strict criteria.
That sounds like a delicate balance, ensuring access without misuse.
Indeed. Another significant challenge is the increasing complexity of care. Modern hospice care now incorporates advanced palliative interventions.
Could you give examples of these advanced interventions?
Certainly. These include patient-controlled analgesia and non-invasive ventilation. Some hospices even offer treatments like radiation therapy, transfusions, or dialysis, though these are not universally required under the Medicare hospice benefit.
So, hospice isn't just basic comfort care anymore. It can involve quite sophisticated medical management.
That's correct. This evolution demands continuous skill development and a broader scope of practice from hospice physicians. Moving beyond the clinical aspects, hospice physicians also face substantial ethical and administrative challenges.
What kind of ethical dilemmas are common in this field?
They often arise in both clinical decision-making and business practices. Navigating these requires a systematic and principled approach.
And the administrative challenges?
Administrative duties can be extensive, contributing to burnout and compassion fatigue among physicians. This necessitates strong self-awareness and robust support systems.
So, the workload and emotional toll are significant factors.
Absolutely. Furthermore, there are considerable regulatory and leadership responsibilities. Hospice medical directors, for instance, are accountable for the entire medical component of hospice care.
Does that include supervising other physicians?
Yes, it involves supervising hospice physicians and actively participating in quality assurance and performance improvement programs. They are also responsible for ensuring compliance with Medicare conditions of participation.
And fiscal responsibilities were mentioned in the source content. How do those fit in as a challenge?
Managing fiscal responsibilities effectively is critical. It's a challenge to balance high-quality patient care with the financial sustainability and regulatory requirements of the organization.
So it's not just about patient care, but also the operational health of the hospice.
Precisely. The roles of hospice medical directors and hospice physicians have expanded considerably, requiring continuous learning and adaptation to these diverse challenges.
To summarize, the challenges in hospice care range from complex clinical decisions like prognostication and managing advanced interventions to significant ethical and administrative burdens and demanding regulatory and fiscal responsibilities.
That's an excellent summary, Eleanor. It highlights the multifaceted nature of the challenges faced by hospice physicians today. All right, Eleanor, to wrap up our session, we've thoroughly explored how hospice physicians weave care into the community ecosystem. We covered the vital role of building strong community partnerships, the impact of direct community education in expanding awareness and referrals, and the significant inherent challenges from eligibility and complex care to ethical and administrative burdens. For your studies, I'd suggest creating a concept map that links these three areas. Think about how effective education can strengthen partnerships and how both can help address some of those inherent challenges. Also, try to recall specific examples for each point, as that often helps solidify understanding for exams.
That's a great idea, Maggie. I'll definitely focus on mapping out those connections and reviewing the specific types of organizations involved in partnerships, as well as the advanced interventions we discussed. Understanding the interconnectedness really makes it click.
Perfect. Next time, we'll delve into the specific leadership roles within hospice and